And welcome, everyone, and welcome once again to In Touch. Once again, talking spine pain diagnostics in Niagara, Wisconsin. Good morning, everyone.
Good morning.
Janet,
Good morning.
how are you?
I'm good.
Busy girl, aren't you?
Yes.
You have a very interesting title that we're going to talk about today and explain what that's all about and who benefits from it. It is called
Radiofrequency Ablation.
And what does that all mean?
Well, the radiofrequency ablation, it is an electrical current passed through a radio wave. And you hear electrical current, and we all think of like the time when we were young and we would stick something in an electrical outlet, and you think, oh, I'm not going to have that done.
You were one of those kids?
I was one of those kids. But it's not that strong or severe.
Right.
It is used in
low voltage. Okay.
Exactly. There's no burning. There's no fire. It's just very hot, heated. And what it does is it goes to a small area of nerve tissue to stop the pain sensory that's causing either your back pain or your neck pain.
It's all related, though, isn't it? Back and neck?
Yes, it is.
And what do you learn from all this? When you do this? Who do you do it on first? What type of patient?
The patients are ones that have chronic, long-lasting neck or mid-back or low back pain. It's hoped to treat back pain.
Okay.
So they come in and they'll see us, and what happens is they have two diagnostic tests, which are called facet joint injections, to see if the joints are what's causing the pain. And then the final end result is the radiofrequency ablation, to give them either 6 to 12 months relief, or sometimes it can last even longer, years down the road.
Are you limited in what you can do then as far as activities?
No, we just ask that you rest the remainder of the day, take it easy, and then you can resume your normal activities.
Wow. It's almost sounding too simple.
It really is. The longest is just having the diagnostic tests done and then able to have the radiofrequency ablation. And then, like I said, you can just resume your normal daily activities the next day.
Well, that sounds like everybody would want to have this done.
You should come see us.
When patients sign up with you or come to see you and want to be one of your patients, are they generally showing up on their own, or do they get a doctor saying this is who you should see? Or can we walk in your door and just say, I'm here, I need help?
Oh, definitely, you can.
Okay.
Oh, definitely. And if you do need a referral, we'll call you and let you know, and you can easily go to your primary care physician, have them send the referral. Or most general insurances, you can just call on your own, and we'll, have you come in and see the physician and go over your treatment plan.
How do you know where to go? That's where your job comes in, right?
Right. You come in, and what you first have done is a consultation with the physician, and he goes over your health history, everything that you've had done, what has or has not worked, and then at that time the doctor will determine what treatment plan works best for you. If it is for, the neck pain or back pain, then he would most likely decide that the facet joint injection, which would lead to the radiofrequency ablation, would be a good treatment plan for you. And then
how big is that needle?
It's not very big.
A lot of people are worried about that, aren't they?
Yes, they are, and it's not. And like I said, when they hear of an electrical current, people think, oh, you're not, going to do that to me. And the most that anybody feels is a pressure sensation. Because we do put in a numbing medication before we even start the treatment to help make it as painless for the patient as possible.
So when should we be walking in your door?
Well, chronic means anything that lasts longer than 3 months. So if you have, pain that has been there for 3 months and you've tried alternative treatments and they're not working, then you should come and see us, and then we can get you started on your treatment plan to help you get back to your normal activities.
You mentioned the neck. What's the most common ailment that causes the pain in one's neck?
It can just be your normal daily activities. If you think about how many times do we move our neck around, and over time it becomes degenerative, or something traumatic, if you were to fall, or even, car accident with whiplash, and then those nerve tissue in there can get irritated, and that's when you have the neck pain.
When we have pain, we seem to favor it one way or the other. So isn't that complicating the whole issue?
Well, no, because you'll have a diagnostic test first on one side, or if you have both sides that are bothering you. But generally, we'll do the worst side first for you,
Sure.
and then it'll give you a better idea of treating the worst side to know where you're at on the other side. And then if that is still bothering you, then we'll treat that side for you also.
Is this occurring other than accidents or other causes like computer screens?
Yes.
Depending where you have it located, they can really be a pain in the neck. But got where I was going almost.
Or sitting in the chair can be a pain in the butt, too.
Yeah, that's true. But all this is related. All our daily activities
Yes.
is related to exactly what we're talking about,
Yes,
isn't it?
yes, it is. Just daily normal activities of mowing the grass, standing at the sink doing the dishes, over, with your neck down, even in your back, standing on hard cement surfaces. All of those things are related causes to, neck and back pain.
Well, you just named all of the above for me, yes.
And myself.
Yes, all of us.
Yes.
These activities we get involved in and don't even think about it
Nope.
until the pain starts, and then we wonder where the pain came from.
That's right. And
I didn't do anything. Well, think back.
Mm-hmm. Yep, you think back or watch what you do, even how you bend or move or pick up anything also contributes to causing the pain.
You mentioned degeneration, too.
Yes.
At what age does that generally start? After we're born, right?
I guess it depends on how good you treated your body.
Yeah.
And most of us don't when we're young. You don't
That's
think
very
that it'll
true,
affect
yeah.
us when we're older. And then don't let it go on too long either, because then, of course, the problem gets harder to treat if you let it go on too long.
Generally, when you have that pain in the neck, this has been coming on for a long time, and that's where it kind of surfaces, isn't it?
Yes.
Mm.
Yeah.
It's almost scary.
Not if you come see us.
I knew that, yes. But that's what I meant. Don't put it off too long.
That's
because
right.
If you do,
Then it can
Just-
lead to
yeah,
other breakdowns
yeah.
that can cause, and then you could have a two-part problem instead of just the neck pain. You could end up with arm pain, headaches too. This helps with headaches also, contributing factors.
Sure.
So,
and medication sometimes just masks the problem.
or you become sensitive, and then actually the
Okay.
pain feels worse for you too. If you're on medications for too long, they do stop working. And,
That's
you
true.
end up
Yeah,
taking
that's very,
more,
very true.
and then the pain also feels at a higher degree for you. And you become hypersensitive.
Ah. Boy, there's a ton of questions we need to ask you. Right?
Yes. And call anytime.
When we get to this point, though, it's, for many of us, you can't do anything without pain. People have quit their normal activities, things they love the most.
It can
Over
help,
the pain, yeah.
It can help lessen the pain for you to get you to a goal where you can resume your normal daily activities. It may not completely get rid of the pain, but it'll make it so you can be productive.
Quality of life.
Exactly, quality of life.
Dr. Singh is, for many of us, so well versed in every area of the body that there's nothing that can happen to you that he can't treat or you can't treat. He's got a pretty good team in line there.
Yes, he does. We have worked with him, myself, for many years. And, he's taught us what to look for, and what to help people and to help, so that, you can resume your normal activities.
What brought you and urged you to seek this education and get involved in this career field?
I think because you never heard of it before. Pain was never anything that was mentioned or talked about. And because you can't see it, you never believed anybody. You would hear people and you would think it's just in their head. Well, and then working and seeing people that would come in that they couldn't move and, they were feeling hopeless, and then coming in and having, treatments with us and just seeing their personality change. They became themselves again. They tell me so many times, you have no idea how good it felt to sleep all night long. Or I could go for a ride to go see my mother and I wasn't in excruciating pain. And to see the turnaround of their whole personality, and that's what made me want to go and stay in this field. because it's very rewarding to see how you can help somebody.
Mm-hmm. You love helping people, don't
Yes.
you? I can tell.
Yes.
I can tell.
It's very nice to hear when they call you.
Well, we tend to do self-diagnosis when we have pain.
That's
No.
right, and we think it'll just go away.
It's a matter of time.
It'll go away.
Sure.
Yep, but just take the time. Just take the time, to come.
And I'm here to tell you, you can spend a lot of money on pillows.
Yes, you can.
Trying
Pillows,
to find
mattress.
the answer.
Yep, mattresses,
It's true. Yeah.
recliners, couches.
Mm-hmm.
Seat cushions.
Well, let me
in the
write
car.
those 3 things off my list then. Yes. I guess my point is we shouldn't leave it to ourselves to try to diagnose this.
Nope, we
We should
shouldn't.
seek help from
From a
the
doctor.
people who know.
That's right.
How do we go about doing this? For some who may not know, they may be new to the area, where you're located.
We are located at 1601 Roosevelt Road in Niagara, and it's Spine Pain Diagnostics. You can come there and ask to, speak to the receptionist. She can get you scheduled, or if you have more information, you can always talk to a nurse. We're always available. Or you can simply call on the telephone, and if you have any questions at that time, you can speak to a nurse, or you can speak with the receptionist and schedule an appointment and meet with the physician.
Mm-hmm. Sounds like the place to be.
It is the place to be.
Again, we need insurance.
No, we do have a self-pay policy. You just have to fill out some
Okay.
information, and then the insurance will work out on what, the price would be,
Sure.
for you. So you don't always need insurance. Like I said, you can fill out the paperwork and find out, if it is something that you can do. And we try to work with everybody.
Unfortunately, in this day and age, not everybody has insurance.
Right, that is true.
When we're talking about degeneration, usually you think older.
Right,
So the elderly are afflicted with this.
yes.
And I suppose that happens, but then you mentioned on the other side, something we have done some time ago that we've forgotten about could be the cause of it.
Yes,
I'm thinking of the elderly, Medicare.
yes.
Do you work with Medicare?
Yes, we do,
Okay.
very much.
This is the place to stop. There's no doubt about that. We all can be pain-free, can't we?
Not completely pain-free, but
Okay.
at a goal that you can resume, a lifestyle of activity.
Okay. Along this line, does weather play a role to some people in the
well,
way they feel?
well, of course, degeneration along with
Sure.
arthritis, go
suppose, sure.
together. So
Yeah.
most definitely. And the most, is to remember that, to get that inflammation. Inflammation is what causes pain. So if we can help
Okay.
rid the inflammation, then your body also can start healing, also. Because, that inflammation will irritate those areas too. So, if we can help calm that inflammation down and get that out of there,
Sure.
then you can start feeling better.
You mentioned 6 months to a year. That
Yes.
you can be pretty close to being pain-free.
Yes.
You can go back to all the great activities you enjoyed before.
Yes. With,
That's giving someone their life back.
yes, it is. Yes.
That's terrific. That's a great idea. We're going to send everybody your way, no doubt. Now, again, I want to have you emphasize, when should we be concerned?
After 3 months.
3 months.
3
okay.
months.
So many of us have had it longer than that.
That's right.
The longer you wait, the
The harder
more
the
sensitive it becomes.
yes,
okay?
and the harder the problem can be
Okay.
to solve.
So we shouldn't put it off.
No, you shouldn't, because you're
Doing
only
it-
going to hurt yourself.
Doing it for ourselves and
Yep.
for our quality of life.
hmm
I have enjoyed talking with you, Jess.
I've enjoyed talking
Thank
to
you.
you.
Thank
You're
you
welcome.
very much. You brought us a lot of good information, and I know there's hope for all of us now.
Yes, there is.
Thank you.
You're welcome.
Yes, from the Spine Pain Diagnostics in Niagara. On In Touch. For In Touch, I'm Aaron Hartman.